Good afternoon, everyone. Thank you for joining us today for our complimentary webinar on Learn How Your Company Can Optimize a Successful Wellness Rewards Program in 2015. I'm Sarah Hunt, Education and Engagement Leader for the Corporate Health and Wellness Association. We're excited to bring you an excellent webinar on how employers are using incentives such as gift cards to really encourage and engage participation in their wellness programs. Today's presentation is brought to you in partnership with the Corporate Health and Wellness Association, Gift Card Partners, and CVS Pharmacy. I'd like to begin today's presentation by introducing and welcoming our presenters. Deborah Merkin is co-CEO and co-owner at Gift Card Partners, Inc. Kate Kennedy is Vice President in Client Management at Provant. Jennifer Patel, Segment Director in Wellness Engagement at Hallmark Business Connections. And we also have Sally Luck, HR Director of Corporate Services and Wellness at Hallmark Cards, Inc. Deborah Merkin brings Gift Card Partners more than 25 years of experience in business-to-business channel development, partner programming, and marketing management. At Provant, Kate Kennedy is responsible for partnering with clients to create and execute health management strategies that fit a particular company's culture. Jennifer Patel leads the Wellness Engagement segment for Hallmark Business Connections, and she provides strategy, vision, design, and implementation for incentive and worksite wellness programs. Our employer case study today is going to be shared by Sally Luck, who has been employed at Hallmark. She has helped strengthen Hallmark's culture of wellness, and we're excited and very honored to have had her as a speaker at our past 3 corporate wellness conferences. Today's webinar will focus on the following: why gift cards provide the most return on investment, how to retain and encourage employees after initial participation, which wellness activities typically have higher participation rates when incentivized, different incentive programs and models, tax implications of incentives based on the Affordable Care Act, and the importance of changing up the incentive design and how variety is really key. We will be recording today's webinar, so we will make that available to each and every one of you. We'll be combining the PowerPoint with the audio and emailing the replay to each of you. Feel free to listen to it and then also share it with your colleagues. Throughout the webinar, feel free to type in any questions into the Q&A box. We will have, at the end of the segment of the webinar, we'll have a segment for Q&A. Again, you can simply type those into the Q&A box, and Deborah from Gift Card Partners will address your questions and present them to Sally. So without further ado, I would now like to pass today's webinar over to Kate, who will provide an introduction into how your company can optimize the success of a wellness program and create sustainable health for your employees and your organization. Kate?
Thank you, Sarah. So I'm very happy to be with you here today. I'd like to just start off first by talking about some of the benefits of offering gift cards for wellness incentives, and then I'll be sharing with you 3 specific case studies that will talk about the application of providing gift cards as part of incentives, and these are some live examples that I think will help bring these ideas to light. So first of all, in terms of the benefits of offering gift cards, one of the leading benefits is that there is an immediacy in rewarding the healthy behavior. Behavioral economics research has shown that one of the most essential elements of an effective incentive program is to provide a reward to participants at the time of or very shortly after they engage in the healthy behavior or meet the outcome that is desired. And so gift cards offer the opportunity to, get that reward right in the hand of the participant very shortly after they complete the activity. And certainly a gift card is tangible. It's something that a participant can hold in their hand, they can see it, and, translate it into a positive purchasing experience just as soon as they have the opportunity to spend the card either in a retailer or even online. Gift cards can also be linked to specific healthy behaviors. This is something that we certainly work with our clients to encourage the linking of gift cards to specific healthy behaviors. And by that, what we mean is that we would encourage our corporate clients to select gift cards from certain retailers that represent, for example, health foods or sporting goods, and that might steer away from using a gift card to purchase items that would be considered less than healthy behaviors. So that's another advantage of using gift cards for wellness incentives. Gift cards can generate buzz in the office. If a gift card is actually distributed, for example, on site at a screening event, it's a conversation starter among coworkers. That visibility can help really drum up some great dialogue among coworkers about the program and can really tap into that social motivation that is so important in terms of driving engagement. And then lastly, for those employers that have a limited incentive budget, if they have, so to speak, they have only a small jar of peanut butter that needs to be spread very thinly, we have found that the instant gratification and that tangibility of a gift card oftentimes is a really great way to get the biggest bang for the buck in terms of wellness programming. So let me turn now to the first of our case studies. In this particular instance, our client is a large multi-institution university system. And so by that I mean that we have, our client is a university system that is made up of 16 individual universities or institutions within the group. The overall eligible population is quite large, around 150,000, and that includes the employees of the university system as well as their spouses, their children, age 18 and up, and retirees of the system. In this particular case, the wellness program that the system offers across all of the institutions is driven primarily by an overall branding for wellness, which really sends a strong message to the university system that they are driving a culture of health. This is a priority that comes from the chancellor on down. And also this branding provides a really great foundation for programming at the institution level to be built on top of this overall wrapper of the brand. For this particular program, there are two requirements, and they're two very straightforward, very simple requirements. Participants need to complete an online health assessment or paper health assessment, and they need to complete a preventative exam. In this particular case, they simply go to their doctor, they complete the preventative exam, and the claims information comes directly back through to Prevent, so there isn't any additional paperwork that's involved. And by doing so, we award participants with a $25 gift card to an online retailer. And this program has driven some sufficient, some strong engagement. It's been about 6 to 7% engagement overall and looking to climb year after year. And again, the emphasis here is that we have this very solid sort of foundational program on which other programming is built. In the next case study, we have a large aerospace and defense company. This is also an organization that has multiple business units, so there's sort of a large corporate structure with individual business units within. And this is a case of where we have seen moderate engagement through the use of gift cards and other incentives. In this case, we have approximately 30,000 eligible members, and for their population, employees only are eligible. The program is a two-tier program that drives health awareness and healthy activities. So the first tier of the program involves gateway requirements. So all participants need to complete a health assessment and a biometric screening, and for doing that, they receive a premium reduction on their health benefits. And also, once someone completes the gateway requirements, they become eligible for quarterly rewards. Quarterly rewards include participants would need to complete 2 activities from a list of possible activities, and this would sort of be a menu option, what we like to call sort of a Chinese menu option, where participants could participate in a challenge, they could complete an online workshop, complete telephonic health coaching, an online cost comparison tool, actually fulfill a prescription at their on-site pharmacy, get a dental cleaning, achieve a lower BMI or body weight, or quit smoking. Some of these options vary by business unit, so it's a really great opportunity to offer some individualized programming for each of the employee populations that we're serving. And participants who complete 2 of the activities receive a $100 gift card to an online retailer. And in year 1 of the program, we are projecting 15% full program engagement. And by that, we're talking about those individuals who both pass the gateway requirements as well as complete at least 2 activities to earn the quarterly rewards. So we're seeing, some, I would consider that, very strong results, especially for year 1 of a program. And then lastly, in the third case study, we have an example of where we have seen the use of gift cards in incentives helping to drive very high engagement. In this particular client example, the organization is a multi-site banking institution. The population is a fair amount smaller than the others that we've been discussing. There's 700 eligible members, including employees and spouses. And what we've seen in this particular case is very deep penetration for a 2-part program, and those 2 parts involving tobacco and wellness activities. So in this particular case, for the first program element, the tobacco, participants need to either complete an affidavit attesting to their tobacco-free status, or they need to complete 2 tobacco cessation coaching calls. And by doing so, they receive a $50 gift card as well as a $500 premium discount. And so what I like about this particular program design is that we have a combination of sort of that immediacy and that tangible nature of the gift card, as well as the connection with the benefit, the linkage to the actual benefit design and receiving the discount on the premium incentive, or the premium. The second component, which is wellness activities, participants would earn points. In this case, they need to earn at least 400 points from a menu of activities, and those activities include both participation activities as well as outcomes thresholds. And by doing so, they earn a $100 gift card as well as an additional $650 premium discount. So not too surprisingly here, since we're seeing some pretty healthy reward dollars, we have seen some very strong engagement. So in year 1 to year 2, we went from 62 to 68% engagement in the tobacco component, and then for the wellness component in year 1 went from 55% to 60% engagement in the wellness component. In this particular case, I will also mention that because of the design of the organization, there was very strong involvement from HR partners as well as the wellness champions at the various sites. So that gives you some flavor of some actual on-the-ground live examples of using gift cards in wellness programs and some live examples of the results that we've seen. So with that, I'm going to turn over here to Jennifer.
Thanks so much, Kate. Now we'll have Jennifer Patel share some of her insight on gift cards in the workplace.
Great. Thank you, Sarah. I appreciate the opportunity to share with you the trends that we are seeing in wellness incentives, as well as some of the things to keep in mind when you're developing your wellness reward design. We're seeing a steady increase in the use of incentives. National studies show that we are up about 15% to an average of $594 per employee in 2014. This is more than double the average of 5 years ago. Of course, the Affordable Care Act has certainly had an impact as well, allowing up to 50% of the cost of coverage when a program includes smoking cessation. While we don't see many employers going to that extreme, it certainly has opened up the conversation when we're consulting with our clients during that program design phase. In addition to the larger incentive budgets, we're really seeing some other trends with our clients as well. Many programs are including spouses and domestic partners in incented activities, and either creating a separate incentive bank or a combined incentive bank for both the employee and the spouse. It can be a great way to support a spouse or domestic partner who wouldn't have direct access to on-site programs, but we can still encourage healthy behavior for addressable health risks through the covering employer. Fitness devices have gone from being a corporate initiative to really being readily accessible at every major retailer, and they're now really affordable as well too. With this emphasis on tracking steps and activity, consumers are excited to learn about ways to have this behavior cross into their workplace wellness program. Incenting participants for participating with a fitness device can really span platform integration to self-reporting off the device for the device of the employee's choice. And of course, verified data is usually the preferred method, but early in the program, self-reported data can really be a great way to get people moving and participating. Our own employees here at HBC, we just completed an activity challenge where we allowed everyone to be incented for every increment of activity. Employees could choose walking or cardio or yoga or any form of activity that they enjoyed that would get them up and moving. We provided incentives weekly, a $50 gift card for the leaders each week, and then the winning team was rewarded with a larger gift card in the end. Next, I'd like to chat a little bit about coaching, and providing incentives during coaching and programs or at the completion of one can really be a great way to reward milestones and participation in that type of educational program. We encourage our clients to utilize an appropriate award amount for the length and involvement of the program as well. So you're making sure that if the program is 12 weeks long, the motivation is appropriate to get someone to make it all the way to the end. And lastly, we're seeing a shift in incentive dollars and amounts for outcomes-based programs, giving participants an added push to participate with encouraging healthy stats like waist circumference, BMI, blood pressure, and cholesterol. Those are the outcomes that we're seeing most often are being in the rewarded category. I want to take a moment to talk a little bit more about the outcomes, and in particular this idea of carrot versus the stick. I'm trying to advance the slide here. Maybe I could have somebody help me do that. The continuum of incentives can range from the rewarding thanks for participating carrot to somewhere in the middle of where achieving the reward is a little more difficult and perhaps outcomes are in play. For example, your blood pressure must fall within a healthy range in order to receive the incentive. On the far end of the spectrum, we see the stick being used to require people to participate if they want the reward, or they have to pay a penalty if they don't meet the outcomes. Oftentimes, we're seeing that as a higher premium cost. I think it's important to talk about this when it comes to plan design, and in particular how incentives are used, because it can have a significant impact on how the program performs. If outcomes or a heavy stick approach is introduced too early, or to a culture that really isn't embracing the existing wellness program, it can have a significant backlash, particularly in the areas of trust. Trust is a key factor in building a culture of health, and your worksite program should reflect where your population is now and be a positive influence on the employees' well-being efforts. We see it often that when outcomes are introduced too fast and coupled with a stick, the program participation will take a nosedive. And then once that trust is compromised, it really becomes very difficult to overcome. So next we'll move on to some additional considerations. So when you're creating your program, there's I've listed 6 here that I think are some considerations to take into consideration. One is around the strategy. Workplace wellness programs really are no longer simply a line item managed by HR to attract prospective employees, but it really is a comprehensive initiative designed to increase efficiency, reduce cost, and create a more productive work environment. We know that employers who use incentives to encourage wellness program participation show significantly higher participation and engagement rates. Next is ongoing incentives, and rewarding employees for getting healthy and achieving results encourages the type of change needed to get a program off the ground and really encourage real shift in employee culture. However, when that behavior changes are new or challenging and they're difficult to sustain, programs really should include incentives and rewards throughout the year in order to drive that long-term engagement. Careful structure is a really important piece. The Affordable Care Act encourages employers to launch workplace wellness programs with financial incentives, including discounts on health insurance premiums. But while employers may be eager to enter into the wellness arena, both to lower their healthcare spending and develop a more productive and engaged workforce, it's really critical for them to design wellness programs that comply with federal workplace laws. The major takeaway on wellness programs is that there has to be a plan. It needs to be in writing, and the alternative standards should be carefully considered. There are great benefits, but there are also some landmines that you need to take into consideration. Simplicity is number 4. I see this often. If a program is too complicated to explain and has too many regulated components, it really won't be adopted very readily. Filling out questionnaires about family medical history, like a health risk assessment, taking a biometric screening for cholesterol or blood pressure, that's a great way to introduce employees to healthy behavior and to really understand their own risk factors. And of course, companies can use that data in order to figure out what their workers' health needs are and to structure communication programs to be effective around that. Momentum is the next one, and that's wellness programs really should offer employees regular events and scheduled activities to keep the momentum going. Ideas that we use in our own workplace are we have health events very often, like free fruit on Mondays or Wednesday walks outside of the office. We'll even offer to sponsor employees for activities like marathons and charity walks and things of that nature. And lastly, I'll combine individuality and freedom together. Really, employees want to have the freedom to choose their own activities, whether it's yoga or a self-defense class. Sometimes talking to a nurse or participating in an official program to get the reward can be intimidating. And we have to remember that program design really can't be one size fits all. It really needs to be a personal and meaningful program in order for it to work. When the journey is positive and has options along the way for individuality, it will have much more success really keeping people involved. So Sarah, I'll turn it back over to you.
Yes, no, thank you. Thanks so much, Jennifer. And now we'll hear from Sally Luck with Hallmark, who will provide the employer perspective. Sally?
Great. Thank you so much, Sarah. I appreciate the opportunity to talk about our wellness program. It's always fun to tell our story. And I'm going to talk to you today about kind of 4 areas, our program design for our Health Rewards program, our incentive strategy as it pertains to cash versus gift cards versus HSA, and the role of challenges and competition in keeping people engaged, and then our communication strategy, which we think is a very key part of our success. So first of all, our program design. We do have a variety of diverse activities, and we are trying to sort of appeal to all employees regardless of physical condition or age or gender. And I see a question came in earlier about what about people with disabilities, and do we make accommodations? And yes, we do, and we have to do that. So we do provide alternatives for anyone who comes forward and self-identifies, and I think that's part of the law that we have to do that. But we really want to make sure that everyone is able to attain our maximum of $400 a year. And we do utilize Hallmark Business Connections to implement and administer our wellness portal and our incentive fulfillment, and also to assist us with strategy and engagement. And Hallmark Business Connections is a subsidiary of Hallmark Cards Incorporated. So our rewards are divided into three categories. First of all, prevention, and we do include points for both employees and spouses and domestic partners, and that would include things like taking the health assessment, getting an annual physical, and participating in on-site or patient service center wellness screenings. And we do on-site wellness screenings in all our locations once a year that's full biometric and lab draws on-site. And so they get points for that. And then education, and that would include health coaching, which we do immediately after our screening and then on an ongoing basis through our medical departments, and taking wellness workshops through the portal and attending Hallmark events like Lunch and Learns, and then we videotape a lot of them, and they can view the videos and get points for that as well. And then the third category is healthy outcomes, and this is a real shift that we've made over time, and Jennifer mentioned not going too fast toward outcomes. We definitely haven't gone fast with it. We started in 2011 with our incentive program, and really at that point started with just awareness and education, and a lot about teaching employees to be better healthcare consumers. We did an extensive training program across all of our locations and paid people for attending these sessions to learn about how they can be better healthcare consumers, what's available to them, what's no out-of-pocket cost to them, and what's available within our own company resources. So we started there, and then in 2014, we finally decided to incent for healthy outcomes, and that is defined as either healthy levels or significant improvement in BMI and blood pressure. And again, we have accommodations if someone has their doctors state that that's not a healthy expectation for them, then they can be exempted from it. But this accounts for $150 of the $400 incentive, and that cannot be earned in any other way. So the next slide then is our incentive strategy, and you know, I said we began our program in 2011. At that point, we did not have an HSA option. That is new for us this year, and so our thinking was that we needed a cash option, which we are doing as a paycheck credit, to help people pay medical premiums. So we offered them a choice between the paycheck credit and the gift card. And we were really surprised. The first year, 2/3 of the redemptions were for gift cards. And, you know, anecdotally, we heard people say things like, oh, I used them to buy shoes, or I gave them for gifts at the holidays, or, you know, I saved up and bought myself a really nice gift. So so that was a bit of a surprise for us. And the gift card redemption continues to be very high into our fourth year here. These two options are taxable. I think that question came in as well. And this year, the only option that is not taxable is the HSA. And so employees are able to redeem their points and deposit it into their HSA pre-tax. And I think the fact that we do have a lot of choices for employees is important, not only in the design of the program, but in how they can redeem their incentive. Last year, we had 83% of those eligible participating, and one location actually had 98% participation. On the portal, we can make redemptions with as little as 25 points or $25. So this provides quick rewards. And I think that was mentioned earlier. That is an important aspect. But on the other hand, there are some people who like to let their points build up for the whole year and cash them out at the end. And we have a fair percentage that actually do that. So I think it's important, though, also that we design our program to make it easy to earn points at the very beginning of the year. So at the very first day, they can complete their health assessment and begin earning points and redeem it right then. And then we really try to keep up steady communications and marketing efforts throughout the year. The healthy outcomes, however, do require the more concerted effort, and we give employees about 6 months of the year to make progress on those. And then also some of our workshops are, as Jennifer said, they're longer in length and require more effort to get to the finish line, and so those are more points. So the role of challenges, I really think challenges and competitions are an important way to keep our employees engaged. And we've provided these since 2012, and they're really outside our regular incentive plan. So they can earn additional rewards outside the $400. And what we've done some that were weight loss. We've encouraged prevention and screenings, exercise challenges, and fruit and vegetable consumption. And we're just about to do another exercise challenge for this year. We are doing these through our portal now, and that really is so much easier, because before we had this portal, we were doing them manually and trying to track, and it was very, very difficult and time-consuming. And what we try to do is we provide some smaller prizes by doing drawings among the participants weekly, and with the idea to surprise and delight. And we do utilize gift cards, small gift cards for these, and really just for people who are making an effort to get registered and to participate at a certain level. But we also have learned that there needs to be a large enough carrot at the end to get people engaged and to make it worthwhile for them. And for us, it seems to be about $500. And we use the Premier Choice Award, which they can redeem for a gift card or many gift cards at a large choice of merchants through HBC. We also publicize the winners, and we put their photos on our intranet and our wellness newsletter, and it really seems to make it special for people. And they're always surprised and looking so happy. But we ask our ambassadors, also our wellness ambassadors, to become engaged by sending out emails before and during the challenges to keep motivating their work groups, because we think people need to hear about once a week from us, from someone that they need to keep at their challenge. We also send out emails through the portal, just encouraging people to keep up with the challenge. So this is just sort of the way that we continue engaging and getting people participating and really keeping the wellness effort top of mind. Also, we do a lot of communicating just throughout the year on a lot of different topics. We do have the opportunity, as I said, through the portal to target email messaging. And so this gives us an opportunity to really send the message to many different groups. Sometimes it's those who haven't logged in recently, maybe who haven't completed their health assessment or haven't had their physical. If they haven't redeemed points recently, that might be a trigger. And then also with tips and deadlines and things like that with the challenges. And then congratulations, recognition to those who have achieved certain milestones, particularly 100% of their possible points. And sometimes we do that with a greeting card too, so that's a nice way to do it. Just recently now, just yesterday, I got a reminder from the portal to sign up for the wellness screening, because we're doing that in a few weeks. And so those are just all things that keep it top of mind with folks. We also really try to make sure that we're doing good corporate communications, and we have a representative on our wellness oversight team who helps us to articulate our strategies and then communicate in various ways. You know, depending on the population and their needs, it might be intranet, it might be wellness newsletters or postcards to the home, particularly if we want to engage the domestic partners and spouses, flyers and posters sometimes in our plant environment. So we have a variety of ways, but we always make sure that we have that corporate communications expertise. And so what we try to do is identify our goals early in the year and then keep them out in front of our employees really throughout the year with that consistent drumbeat. So hopefully they know what our focus is for the year and we're driving home those messages. And one thing that we did learn early on, too, is that keeping our wellness brand identity intact is very important. And so that means that all our wellness-related communications and presentations and materials follow our style guide. And we developed that early on, and so that's a logo, it's a color palette, it's a style of photography, and even a font that we use that identifies wellness communications. And so hopefully it makes anything related to wellness stand out, and if you get a mailing at home and it's a bright green and orange postcard, you know it's wellness and it doesn't go in the trash. Another thing we like to do, too, is feature success stories of people who've been inspired or frightened by our programs, but to take action to improve their health. And this might be a panel presentation to a large group, or it might be a testimonial video, or featuring them in a newsletter or a news article on our intranet. And it's just a really great way to put a real-life face on what we do and hopefully to inspire others to embark on their journey. So, you know, I really think that the communications have been key, one of the keys to our success of our program, but there's certainly many factors, and I think there are many ways to design a wellness rewards program. I think gift cards are an important factor, both in the choice that they provide and for continued engagement and a successful program. So with that, I think I turn it back over to Kate, and we're going to take some questions. Thank you.
Yes. Thank you so much, Sally. Great insight. I know we've got a lot of questions coming in. Just want to thank Kate, Jennifer, and Sally for sharing with us your expertise and insight. I'd now like to announce the opportunity for all of the attendees to enter any questions. Again, I know we've already received a lot so far, so you can begin typing those in the Q&A box on the right-hand side of your screen. And I'll pass the mic over to Deborah with Gift Card Partners, who will assist in moderating your questions as they come in. Deborah?
Hi, thank you, Sarah. There were a lot of questions, by the way, so thank you and keep them coming. But this is for any of our panelists. What do you consider a successful engagement level? When you see low participation rates, are they mainly due to privacy concerns or other issues, like sponsorship, awareness, or motivation? Anybody want to take that?
This is Jennifer. I'd be willing to respond to that. We typically look at participation rates. We like to see them fall between 70% and above. Many of our programs tend to fall in that low 80% range. Of course, everyone would like to have 100% participation, but that's not always possible. But definitely 70 and above is where we shoot to have our programs fall. typically when we're evaluating why something isn't working or why a program is not performing, most likely it's around awareness. It's that lack of communication. We see this time and time again. Companies will spend a lot of money to put a really robust, great program in place, but they're not communicating where it is or what the benefits are, and all of the great opportunity that comes as a result of it. Sometimes it isn't trust, and I think that's a great question. That can it sometimes be a result of lack of trust? You know, every culture, every organization has a different culture, and frankly, I think that we see that too with different locations or different parts of an organization will have a different culture in how they're adopting their wellness programs. So you really have to look at all of those different pieces, but 9 times out of 10, it's people don't know about it, and they're not participating because they don't understand the benefit or even how to get there.
Okay, thank you. Another question from that I've been wheeling through is in today's companies, we're providing employees wearables. You mentioned Fitbit earlier to help engagement. Is a wearable a true incentive or just a way of measuring engagement? And anybody can answer that also, any of the participants.
Well, I'll take that one. This is Sally.
Thank you.
You know, yes, you're welcome. I think that they can be, you know, either a very good incentive, or I think that they can be something that someone might wear for a little bit and then put in the drawer. And I think that there has to be, you know, some skin in the game from the employee. I think they have to exert some effort and recognize the value of the wearable. And I think it's a mistake to just hand it to them. But then I think there's a responsibility with the employer to continue to engage the employee through challenges or through you know, ongoing communications about the value of the wearable, and you know, to try to make sure that they don't just think that, oh, my employer gave me this and now they've forgotten about it, that the employer is demonstrating that they see value in engaging the employee with the wearable.
Here's a question that I think affects everybody. Kate, I'm going to direct it to you. What do you suggest when you can't seem to get a buy-in from your managers and therefore are not getting the support in sending out messaging or promoting the program?
Yeah, so I would say, you know, this is something that we do see in our client organizations to a lesser or greater extent. You know, oftentimes it sort of depends on where the wellness initiative is generated from. So sometimes we see in organizations where the wellness program is generated more from sort of a grassroots effort. You know, employees start to do organize themselves around community races, for example. But typically it is, you know, HR and the benefits function that is sponsoring the wellness incentives. And really what we do is we partner with our client organizations to translate and partner with them to sort of translate the value of driving a wellness program and the return that can be gotten from that to talk in the language of business, because really, you know, organizational health is a business imperative. Leaders do, you know, the research and literature today indicates that leaders of organizations do understand that if their employees are healthy, they're bringing their better selves to work. They are more productive on the job, more engaged. They are more committed to their employer. They value the fact that their employer is providing these opportunities to stay healthy or to get healthier. So it's really, you know, I think it's our job as wellness professionals to be working in partnership with the sponsoring group within an organization to sort of translate, you know, the benefits of a wellness program, to talk about the direct value to the business, not just in terms of cost savings. I think that's where the dialogue has been traditionally. Traditionally, we talk about return on investment with, well, over X amount of time, we can see a reduction in high claims costs. That conversation is really evolving these days, and it's expanding to include not just the potential cost savings, but the added value to the organization with increased productivity and actually adding to the top line, not just helping to preserve the bottom line.
Thank you. I'm going to direct this at all three of you because I think you all have something to contribute. Do you feel a company can still have successful wellness programs with $150 in incentives offered yearly? I assume they mean per employee. Or is there a recommended amount for the best results? Sally, do you want to take that to start with?
Sure, I will. Well, I think that's not very much, so I think you are going to have to be very thoughtful in what you think is going to most quickly and in a sustained manner engage the employees. I would say I would probably spend it making it fun and probably doing some challenges and trying to structure it so that everyone can participate. And you know, definitely create some buzz around it, create some you know, some good marketing, and you know, have it be, you know, something that people are really talking about. And then hopefully if there's success with that, then, you know, next year maybe you can grow it. When we first started, we started with $250 a year. And we had pretty high engagement that first year. I will say before that, we gave a, let me think, I believe it was a $50 incentive for completing the health assessment, and we had very low participation. But we didn't really tell people. We didn't really do good marketing and communication, and we didn't really create a buzz about it. So I think it's very possible, but it takes, you know, quite a bit of work to be able to, you know, and create excitement and get people engaged and get people talking about it, and that's the key.
What do you think the average amount should be invested in incentives in these programs to make them successful?
You know, I am liking where we are at about $400, and I believe Jennifer said the average is closer to $600. But again, I think it's not necessarily the amount, but the work that goes into engaging employees and bringing them activities and, you know, and things that they can learn and that they can get involved in that bring the value to the employee and to the company.
Yeah, this is Kate. Just to add to what's already been said, I think the trick in terms of determining the right incentive level is, you know, think of the dollar value that you're going to be offering as it's really the external motivator. It's really what's going to be enough for people to sort of stand up and pay attention and be motivated to take action. But the other, you know, part of that that's just as, if not more critical, is whatever it is that you're offering for people to do, or quite frankly, you know, asking for people to do, what sort of hoops you're asking people to jump through, what's the actual experience they're going to have doing that, and will they recognize other value, more intrinsic motivation by becoming a part of that challenge or, you know, meeting that particular health goal with their health coach? That's really what makes these programs sticky and sustained, and that's what really drives the best value over time.
Thank you.
This is Sarah. I just saw a question that came in that I think is really interesting. Mary Ellen asked, and maybe Sally, you can address this, if you're tracking who's actually winning the incentives, are they the unhealthy people or those that are already healthy?
You know, it is interesting. One would think that it might be the corporate headquarters employees, but we actually have a group that is a distribution center group that's our highest participating and And they are actually a pretty healthy group, though, too. But I think in general, what we do see is our sales divisions and our headquarters have our highest participation, and our supply chain, which tends to be, distribution and manufacturing and older employees, have our lower participation and engagement. And it is interesting, too, that when you look at overall engagement, so when we do Connecta surveys, and when we look at the scores by location, there is a correlation in overall engagement and engagement in our incentive program.
This is Jennifer. I'd like to piggyback on what Sally said, and it goes back to what I said in my remarks, that the role of communication and how you promote your program is really critical. And one of the best ways to get at those low engaging populations is really communicating the value and the benefits that someone can get out of the program. But it also goes to, when you think about best practices with wellness programs, one of the key ones is involving your leadership and having leadership support, and that really lends itself to your mid-level managers. If your mid-level managers aren't supporting the program and allowing for the time off, or giving people the opportunity to participate, that engagement will be low in those particular areas. So it's really important that there's a plan in place too for how to get leadership and management on board and communicating the benefits of the program. And that's one way to get at those low engagement groups.
Thank you. There was a follow-up question, which I think you just answered, but I'm going to ask for it again, is our organization has 25 employees in 25 corporate locations, 100 employees that work remotely throughout the U.S. What are your thoughts on engaging the remote employees? They can work from their home or from a healthcare facility. Do you have any ideas of which ones, Kate, that you think, which ideas to engage a dispersed workforce that's geographically remote?
Sure. Well, certainly, you can think of some of those core activities that we had talked about, the gatekeepers, which are really important to have as a foundation. Often it's the health assessment, which can be completed and is typically completed online, and then the biometric screening. And so for the distributed workforce, we offer remote options to complete the biometric screening, whether that's receiving the information that's submitted from a physician's office or through a lab screening. So that's a really great way to offer the opportunity for biometric screenings to a distributed workforce. As far as some of the other activities that we've all been talking about that have been found to have success in wellness programs, the challenges are a great way to allow individuals who are working, whether it's from their home or, just a small group in a branch office, to participate through an online platform and even join teams with members who are located in other locations or be part of a business unit team, so that there really is that idea of, bringing together groups of employees who are based, spread out in very disparate locations, but still having sort of this unified communications platform that reports on progress and provides encouragement among and across the employee population. So that's just some initial thoughts off the top of my head.
Thank you.
This is Sally. May I add to that, please?
Sure.
So I totally agree with what Kate said, and just would add that almost all our points, other than the preventive ones, can be entered and redeemed, or earned, and redeemed through our wellness portal. So you can take workshops, you can earn all of the education and actually coaching. There's online coaching through the portal. You can take the health assessment there. The challenges are handled through the portal. We do also offer the option to have lab screening done at patient service centers wherever people are located. And so I think, having a portal is a great way to unify a workforce and have it be pretty low administration from a management standpoint, and have accessibility really to everyone.
Thank you. Headed back to the reward part, do participants prefer healthy gift card options or generic ones such as a prepaid Visa or MasterCard? And is there a difference in outcome between the two?
Jennifer, that sounds like one for you.
Yeah, I was going to say I'll speak to that.
Thanks.
So we believe that it's really important that you give your employee a choice and give them the opportunity to select something that's meaningful and memorable for them. And as Sally discussed earlier, the use of a prepaid card can be used at a liquor store. It can be used to buy cigarettes. It can be used to support unhealthy behaviors. So we love the idea of using, we have a select group of merchants that support healthy behaviors, and we have some clients that choose that. We have others that want it to be wide open, but when you're supporting particularly a wellness campaign, we shy away from using those prepaid cards because you just never know how they're being spent. And so if you want people to be healthy, you need to support that behavior. And certainly there are restricted spend cards available too, and that allows only for particular kinds of merchandise. So that can be a great option in a wellness arena as well.
May I add that CVS developed a card a couple of years ago called the CVS Select Card, and that is a card that only debits at CVS on healthy items. So it can they don't do cigarettes anymore, obviously, but it will not debit on alcohol or candy or junk food and things like that.
That's interesting. This is Sally, and we did choose, even though there is a very large choice of merchants that employees can redeem their awards for, we did choose to not have any restaurants just because it would be very difficult to filter out what are the so-called healthy restaurants and less so. So I think if there is some ability to tailor the choices that are available to the employee.
Thank you.
But we don't track outcomes, and we don't really track what merchants they redeem their cards at.
Sarah, do we have time for one more question?
Yeah, I think one more, yep.
Okay. So this is a follow-on. Are there requirements as to the type of gift cards that can be used in a wellness program? And I don't believe there are, but anybody can answer that. Jennifer?
Can you repeat the question, please?
Yeah, there's no requirements by anybody, legally or otherwise, that require specific gift cards or specific types of rewards.
No, there's nothing that would require you to offer a certain kind or I mean there's just limits on the amount that you can offer, which is a really large amount if you consider the new rules with the ACA. We very rarely ever run up against an employer who's willing to offer that amount, but nothing about the kind of.
And this is a question for all of you as well. Do you set up your own portal, and I assume that means the company portal, or does the company manage it? Do you set it up for them, or does the company manage their own portal? the health and wellness program, I guess.
This is Kate. I guess I would say, certainly we do administer the portal on behalf of our clients, and I think what we've found generally is that employers are looking to have sort of a third party involved in administering the program for the sake of confidentiality. So, I'm not sure how it would be perceived by an employee if their own, in-house group were administering a portal that's capturing or reporting on PHI, specific health information. So I think that's part of the value of working with an outsourced partner.
Thank you. And oh, go ahead, sorry.
Well, this is Sally, and I agree with that. We have the benefit that Hallmark Business Connections is a separate entity, and so we don't ever see the specific health information. And I think that's a very important consideration. Plus, most of us are doing wellness in addition to many other things, and it's just really nice to have a third party to administer the portal.
Excellent. Well, I want to, thank everybody on behalf of the Corporate Health and Wellness Association. We had a great Q&A segment. On behalf of today's presenters, I want to thank each and every one of you for joining us. A special thanks to gift card partners and CVS Pharmacy for helping to make today's webinar possible. And a special thanks to Kate, Jennifer, and Sally for sharing their expertise on this topic. We're running a little behind, so I'm just going to run through these slides, but we want to invite each and every one of you to attend our annual conference, our Corporate Wellness Conference that's going to be held September 27th through the 30th in Orlando. We bring in, dozens and dozens of case studies similar to that of Hallmark and the one shared today on some of the biggest challenges in regards to engagement, legalities, nutrition, fitness. We'll have a whole session dedicated to data privacy and wearable devices at this year's event. And we've got a lot of collaborative forums. This year we're excited to announce we've got a Navigating Cancer Care in the Workplace forum. We have a forum on on-site clinics, healthy foods in the workplace, mindfulness. This year we have also partnered with Healthiest Employers Awards. So the national award ceremony with up to 400 employers will be invited to participate, and we'll be recognizing the top 100 employers, healthiest employers in the country. That'll take place within our annual conference. And on behalf of gift card partners and CVS Pharmacy, as a thank you for participating in today's webinar, we would like to extend employers a complimentary pass, a free pass of over $1,000 in value if you register before Thursday, April 2nd. You can just use the discount code Go Gift Card Partners and click on the link to register. Again, a huge thank you to today's presenters. What valuable insight you guys have each brought, and thank you again to all of the participants that joined today's webinar, and thank you again. We will be sending each and every one of you a replay of the webinar, so please, pass along to your colleagues, and thank everyone again for participating, and have a great rest of the week.